So for those of you who are frontline in the field, the main ultrasound technique you need is a FAST scan. FAST exam stands for Focus Assessment with Sonography in Trauma. And the aim of this is to identify blood in key main cavities that it will collect after a traumatic insult in your body. So this all started with three main abdominal views: your right upper quadrant, your left upper quadrant, and your pelvic views. But as you know, there are other cavities that can also collect blood after trauma. So we have extended this to include the base of the lungs and the pericardial space, because these are key things you can intervene with to save your patient's life. Let's just start with some key landmarks. So we've got a patient here, it's a scanning mannequin, and we have the right upper quadrant here, we have the left upper quadrant here, and we have the pelvis here. In the right upper quadrant, we need our key landmarks to be the anterior axillary line, the mid-axillary line, and the posterior axillary line. We will then have the same on the other side of the body, on the left upper quadrant. And then for the pelvic views, we want to be aware of where the pubic symphysis is. And that's the bone that you can easily palpate just above your groin. So we want to take the probe, and the probe marker needs to be pointing up towards the patient's head. We need to hold the probe in something that's comfortable for us, depending on the position that we're in. I like to hold it underneath my hand like this when I'm scanning the right upper quadrant. You then place the probe in that right upper quadrant at the mid-axillary line. And the main structure that we'll be faced with is the liver. So the liver is a key landmark in that right upper quadrant because it's very, very large and ultrasound can go through it very readily. The key other structures that we want to look for are the kidney, and between the liver and the kidney is Morrison's pouch. That is one of the key dependent spaces where blood can accumulate. And in fact, in this mannequin, you can see that there is a hypoechoic, or a very dark stripe of blood within Morrison's pouch. You can then slide inferiorly towards the patient's feet to get a slightly better view of the kidney. And one of the key areas to look at is that inferior tip of the liver, because sometimes in early bleeding, that can be the only place where blood accumulates. We can then slide up the patient's chest, and we will see a bright white line that curves down that is the diaphragm. Anything superior to this is the pleural cavity. And again, if you see blood, that will appear very black. So we can then do the same thing on the other side. On the left upper quadrant, our landmarks are very, very similar. However, because of the spleen being much smaller as our acoustic window, it's often easier to start in the posterior axillary line. So for this, I'm going to hold the probe slightly more like a pencil if I'm scanning on the patient's right-hand side. And then I'm going to curve round the patient, put my knuckles into the bed or onto the floor, and then scan from the posterior axillary line. And the key landmark that we will see here is the spleen. Again, the spleen is a little bit smaller, so you may need to scan around a little bit to find your landmarks, but the key landmarks are going to be the spleen, the left kidney, and we can scan down the patient's chest to see the left kidney slightly better. And then we can scan up the patient's chest to identify again that diaphragm, that's that curved bright line, and the left lung base. And again, you can see here that we don't only have fluid in the peritoneal cavity, shown by this black stripe between the kidney and the spleen, we also have blood above the diaphragm, meaning that this patient very likely also has thoracic trauma and bleeding into their thoracic cavity. So that is a hemothorax. And where you get a hemothorax in trauma, you often also have a pneumothorax. So that would be a hemopneumothorax. The last view that we do in the abdominal scanning is a suprapubic view. So depending on how the patient is orientated, sometimes fluid just accumulates down there because of gravity. This will entail two views, both the transverse and sagittal. So You take the probe again, holding it like a pencil, rest that hand down on the patient, above that pubic symphysis, that is a landmark that you can feel, and then place the probe in a horizontal position onto the patient. Given that the bladder, which is your main landmark here, is a pelvic structure, and we're currently scanning over the abdomen, you need to tilt the probe to shine the beam into the pelvis. And there you'll see the bladder, which is a structure surrounded by a regular border filled with urine. As you fan through this structure, you may see extra areas of dark fluid that have accumulated there because of bleeding. So again, you want to fan all the way through the key structure here, which is the bladder. After you've done that, you will rotate the probe by 90 degrees to have the probe marker pointing up towards the patient's head. And again, this is a pelvic structure, so you're going to shine that beam into the pelvis. There, once again, you see the bladder, and then in the context of trauma, you will also potentially see some free fluid, which will be blood. So now we've been able to look at both the abdomen and the pleural bases. So there's only one other additional thing that we need to do for the extended fast scan, and that's looking for a hemopericardium, so looking at the heart. So for this, we'll utilize a subcostal view of the heart. So we will take the probe. If we're using a fast preset, the probe marker will be pointing towards the left-hand side. The patient's right, but your left-hand side. You will place the probe in the subcostal area. So that's just below the xiphisternum. The key landmarks that you can see here are the inferior vena cava and the aorta. Given that the heart is a thoracic structure, not an abdominal structure, we then need to tilt the probe to shine that beam into the thoracic cavity. And there we should see the heart in the far field of our view. So for this view, you will clearly see that there's blood within the cardiac chambers, but you may also see a pericardial effusion or hemopericardium surrounding the heart. So this is really all you need to do an extended fast scan. And in reality, you can get this done in under 20 to 30 seconds. So the way that I would do it is place the probe first in the right upper quadrant. If I see blood here, I don't need to do any other of the abdominal scanning because I already know that there is blood in the abdomen. From there, I will move across the patient's body and I will go straight into the subcostal view and assess the pericardium. From there, I would change my hand position and then move to the left upper quadrant. Again, for each view, you're going to fan all the way through to make sure you don't miss anything. You're going to slide up to look at the pleural base, and you're going to slide down to catch the inferior pole of either the spleen or the liver. Then I will take the probe off and I will go into the pelvic views and I will scan down into the pelvis. Then I will rotate the probe around 90 degrees and do the same thing but in the sagittal view. And that is your fast scan done.